All right, so why was it even brought up? So I'm Stephen Lupe. I'm Dr. Stephen Lupe. I'm the Director of Behavioral Health over at the Cleveland Clinic in the Department of Gastroenterology. That may seem a little odd, like why is there a psychologist over in the Department of Gastroenterology? And I think it gets back to exactly what we were starting to talk about with the fatigue. All of these things that happen inside the human body are so multifactorial that we have to address things as a whole human being. So we look at fatigue, right? Fatigue can be caused by a lot of different things. But then it also tends to take us out of our life a lot, which then decreases mood, which increases fatigue, and there's inflammation that happens with that. And so really the way that we have to work on these things is total overall. And you're talking about CBT, one of the goals of CBT is trying to get us back moving a little bit, and that's got to be done very carefully in fatigue, right? Because with fatigue, if I get you moving too quickly, you're going to be too tired, and now we've disrupted things. So it has to be done very, very slowly. But we'll get more to that. No disclosures. So my talk's really about anxiety, and why should we even talk about anxiety? And it's really because we're whole human beings. Our gut is hardwired to everything we do, and everything that happens affects the gut. So this recent study looked at it and found that people who were diagnosed with inflammatory bowel disease were more likely to experience anxiety. And there's probably lots of reasons for that. So when I talk to people about this, there's a bidirectional relationship even with anxiety. That it turns out that we're starting to explore this crazy thing a lot of people may have heard of called the gut microbiome. And it turns out that the gut microbiome may be altered in people who develop inflammatory bowel disease. And one of the symptoms of that altered gut microbiome may be mood problems and anxiety. So that may be part of it. We're not real sure. Stay tuned for that. We're still looking at it. We know that we see some differences, but we're not entirely sure what we're looking at yet. The other thing is, and I always say this to people, is having an inflammatory bowel disease and having the symptoms that come with an inflammatory bowel disease lend themselves to things like anxiety. When I always point this out when I go to medical conferences and stuff, and I talk to my medical colleagues about it, especially ones who don't necessarily work with people diagnosed with an inflammatory bowel disease. Take the symptoms of urgency and frequency or pain. I always say it to them, if I hooked a shock collar to your neck, and every time you went to go out to your car, I shocked you, how long would it take for you to get anxious about going out to your car, right? And so some of this stuff shows up as a natural byproduct of having an inflammatory bowel disease. We know that if it does show up, it can reduce the quality of life. It tends to stop us from doing things. We developed with this wonderful mind that anxiety has been very helpful for, to help us predict what's coming and keep us safe. If you look at the purpose of anxiety, that's why we have anxiety as human beings. Because the people that could look at a trail that goes into the woods and goes, I'm not walking down there, there may be a bear, those people lived, and they passed on their genes. The people that went, I don't care, and ran down the pathway, they got eaten by the bear. So it tends to help us quite a bit. But then we look at it with these symptoms, and we start predicting the symptoms, and that can lead to a lot of anxiety, which then can increase symptoms, which then increases anxiety. And so it can start narrowing down what people can do. If I start going, I can't go out with my friends because I'm scared I'm going to have an accident. I'm scared there's not going to be a bathroom. I'm scared. We start predicting these things, and the minds are trying to help us by predicting this, but what it does is it tends to narrow down what people can do, which then tends to create more stress, and round we go. So that's that bidirectional relationship I was talking about. So it goes both ways. So the people that develop a anxiety or stress, they tend to have more symptoms. More symptoms tend to result in anxiety and stress. And if someone starts experiencing these things, especially if someone develops what they end up being diagnosed with an anxiety or depression, those people tend to have more flares, more symptoms, and are more likely to have surgical outcomes. So there's that. right there. So symptoms, anxiety, and depression. So we need to talk about this. And this is why you're hearing all my colleagues today start talking about this, is why we need to address it as a multidisciplinary team. Because there's chances in here all the way along to start getting in working with people, which then can reduce anxiety and start breaking some of that cycle I keep talking about. And I think normalizing it too, so that people are able to talk about it and going, look, this may be a symptom of IBD, having like an anxiety or depression, in that we need to help you work with that as a team. So what is anxiety? As I already kind of hinted at, it's this feeling of tension, apprehension, nervousness, and worry, and physical arousal. It's got to have all those things to be diagnosed. We evolved it to detect threats. That's why it's there. It's actually our mind trying to help us, believe it or not, even though it feels really unpleasant a lot of times. And we get stuck in these things a lot of times trying to make it go away, and we'll talk more about that. It gets extended to all areas of life, and it's not uncommon with worry but about symptoms, but being able to participate in life. And that's what I was talking about. Not only worrying about symptoms like pain, urgency, frequency, constipation, gas, but then how do I continue to participate in my life and do these things? And you can see how this all starts to add up, and it can lead to some of those symptoms up there. This is important because it shows kind of like what can happen in anxiety, and this is pretty common, okay? So take a situation where you may feel anxious. So let's go back to talking about a hypothetical person that I was talking about. Let's say they have to go to the grocery store, and they're in the middle of having a symptom flare, okay? They start thinking about going to the grocery store, and what happens to anxiety? It starts going up, right? We start predicting everything that could happen, and it builds and builds and builds and builds, right? Eventually the person goes, I'm not going, I can't go. What happens to the anxiety as soon as you decide, I'm not gonna go and I'm gonna stay home in my house with the bathroom? Anxiety tends to go, whoosh, drop, okay? This whoosh, feels so good to human beings that the next day we've rewarded anxiety. So the next day we're more likely to be anxious and we're less likely to go out and do things. And you'll see this grow and grow and grow as people like progress with this, and it shuts down life more and more. And that's called the avoidance cycle. I always show this to people so that they can understand kind of what's going on, and it's absolutely normal. Escaping and getting away causes short-term relief, which then long-term we'll see anxiety levels go like this, keep growing and growing and growing. And it's very hard, and this is why I work with people doing these behavioral things to figure out how do we keep moving through this, and how do we keep going with all of these thoughts, because this thing's a giant problem solver, and it sits up between our ears doing this all day, trying to be helpful. Sometimes it's very helpful, other times it's not. And how do we have that and continue on with life? So what do we do about it? Oh, good, so the first thing I start working with people on when I start working with people in my clinic, and I see lots and lots of people every day, is starting to figure out what is anxiety, okay? We tend to start thinking about anxiety, and it tends to feel like this thing that's gonna like end life. It tends to be pretty intense. People don't like it. No one, I've never met anybody who was, Dr. Lupe, can you make me more anxious? That's never happened. And so, we start looking at this for what it is versus what it says it is. It says it's danger. It says it's threat. It says it's terrible. It's, but let's look at it for what it is. These are thoughts that are going through our mind. So even when I'm working with someone, and we'll come back to this here in a minute, we're looking at when someone's starting to predict things, when they're starting to look at like, I'm going to be stuck in the grocery store and I'm not going to have a bathroom. And, it's like, we'll do this thing. It's like time out, time out, time out. Let's look around the room right now. Where are we even at? Is this happening right now, or are these thoughts? So we have to acknowledge it for what it is. They're thoughts, they're sensations in our body, they're feelings, okay? Second, I always go back to that. The mind is trying to help, and we try to fight it a lot of times. So it's up there talking, trying to keep us safe. It's trying to keep us from running into these problems. It's trying to keep us from having bad accidents and getting into these situations that can be embarrassing. It's trying to keep us out of pain. Look how helpful this can be for like pain avoidance, and we see this with like food restriction, right? Is a lot of the patients I work with, food becomes something that can make us hurt. And we'll start going, well, I need to avoid, I need to avoid, I need to avoid. And it just, our mind's up there trying to help. A lot of times, though, it's like, okay, it's making pain go away in the short term, but what are we doing to help in the long term? And we have to work on these things to build it back out, including the anxiety that comes up around food a lot of times. And then some techniques that have been shown to help, these are just some brief ones that are up there. So breathing, mindfulness, which I'll come back to. And I want to point out for these things, these are not designed to make anxiety go away. You ever want to make anxiety worse? Try not to have it. You know, I have to talk to partners about this all the time. Never in the history of making someone calm down has telling them to calm down work. And if you really want to make them angry, tell them just breathe. It does not work for people. And so even, we were talking about CBT earlier. A big thing in CBT is coping skills. Look at what the term coping means. It does not mean making go away. It's like a life raft we use to ride the wave in, okay? In your experience, for all those people out there who have had anxiety or worry, does it last forever? Not usually. It tends to go like this. But when we're in the middle of it, it feels like it's going to last forever. It's almost like being in the middle of a hurricane. It's like, I have to do something. This is terrible. Realistically, if we can slow down and back up a little bit, we realize it does not last forever. It tends to go like this. And these things are just lifeboats that we can use to ride that wave, okay? One of the ways that we found, actually the only real successful way we've ever found to really treat anxiety in a long-term way, is something called exposure therapy, where we have to have people sit with the anxiety until their body calms down. And we can do that working with some of these things. Let's sit here and see this for what it is so we can ride it out and our body can learn to function with it. Using some of those lifeboats, so diaphragmatic breathing. When we look at diaphragmatic breathing, it's getting the air really deep down. Mindfulness, this is really learning to watch what's going on. It's a very big term in society now, everything we're doing with mindfulness. And a lot of people have the idea that meditation is designed to make your mind shut off. I always tell people, if that's your goal with meditation, I really wish you the best of luck. The Dalai Lama's been doing it for 80 years, and he can't make his mind be quiet. And if he can't do it, I'm not thinking I'm going to. Imagery. This is kind of using the reverse process of what we're even talking about that causes anxiety. Human beings don't have to be experiencing something to experience it. I can sit in my living room and picture being stuck in a car, having to go to the bathroom, and I will react to it from my living room, just like it's happening. And we can use that in reverse with imagery, so even picturing something very calming, something very nice, and trying to get the body to go the opposite direction of that. One of the things I always talk with people about is with anxiety, we may not have control over the anxiety, but we have control over our body a lot of times. I can't change what my mind is doing a lot of times. It just sits there and runs. I can't change the feelings that are coming up in my body. But what I do have control over is my body. I can do things like, I'll work with people even, and I'll be like, so while you're sad, can you do this? Right? I have control over that. So I can go do things with my body, and these are all things we can do with our body. Progressive muscle relaxation, tensing up, and then releasing to feel the difference in working with our body that way. One of the ones we'll do here at the very end is grounding in the present moment. And this is one of the places I start usually with a lot of people, is figuring out, how do I get back to this room so I can see if threat's really happening right now, okay? Human beings were kind of developed. We have two nervous systems. We have one called the fight or flight system, or the sympathetic nervous system, and then the rest and digest system, or the parasympathetic nervous system. when we go into a fight or flight reaction, a couple things happen, including it changes the functioning of the gut. It dries up some of the secretions down in the gut, slows down digestion in the gut, which is why we tend to feel like butterflies. Nausea can result from this. And so when someone's having an anxiety reaction, it's not uncommon, along with turning up the volume knobs on all the sensations in the gut, for the gut to actually start changing a little bit. On top of that, we dump lots of inflammatory hormones. You can just see how all of this is so connected. And so working on what can we do that are more pro rest and digest exercises. And these are all things that elicit that rest and digest system, including focusing what we have control over. Okay. Do you have control over what happens 20 minutes from now? A little bit, but let me say this. Go to the store from this room. It's like we'll work on this. Go to the store from this room. I'll sit here and wait, right? You can't do that. Go do something 20 minutes from now from right here. You have to wait for 20 minutes. So we have to figure out, what do we even have control over here? And that tends to be very helpful too in eliciting that rest and digest system. And then we also have to work on prevention of anxiety, stress, and depression. And those are things that we can do for prevention. On top of medication, a lot of times our providers will work with us on medications. And I want to kind of do a brief talk thing about that too. A lot of the gastroenterologists I work with will use these medications that traditionally we've called like antidepressants. We call them neuromodulators in the middle of gastroenterology, because most people don't realize this. A lot of you may have even heard of a chemical called serotonin. 90 to 95% of the body's serotonin is actually in the gut. It's not in the brain. And it's doing things like helping with sensation and movement and communication of the nervous system within the gut. And so we'll use some of those medications. So if you're a gastroenterologist, you come in and they go, well, I want to start you on a low dose of an antidepressant. It may not be because you're depressed or anything. It may be because we're working on symptoms within the gut, working with the neurochemistry of the gut. One of the great byproducts is sometimes it does decrease some of these symptoms. This is important for the family and friends in the room, okay? I already went over that one. If your loved one is anxious or if they're having a stressful time, telling them to calm down doesn't usually work. Usually it just makes the person kind of like, they may get quiet even, but I hear from patients all the time, I don't feel like people get me, and I don't feel like, I can talk about what's going on. Try to see what they need. And remember, people may not know why they feel this way, and that's so common for us to do. That's another thing human beings naturally do, is we want to know why things are happening. So we'll ask people, why are you upset right now? And people may not know in the moment why they're upset. They just feel upset, and they may just need someone there with them. And I always tell people that too. Sometimes just being there is an intervention you can do for your loved ones. Making sure you ask them what they need, if they know. Encourage communication by listening. So sometimes just being there and hearing what's going on with people, that support does activate that rest and digest system, and it starts helping people kind of calm down. And it is okay to be upset, especially when we're talking about functioning in the middle of an inflammatory bowel disease. It is okay to be upset. This is one of those things that is hard for a lot of people. That, it's like, I'm so upset about this. I was diagnosed with Crohn's disease, and I feel like I shouldn't be this upset about it. And then, like, when I turn it around, I go, well, wait a minute, let's turn this around, and let me say that maybe, you come in and we're talking, and I go, hey, I want to run something by you and see what you think. I was just told I have this disease that we don't have a cure for, that's going to involve being on medication for the rest of my life, that generally has like this trend that goes like this, although there are some periods where it gets better. And I have all these symptoms going on, and it's really affecting my life, and I feel upset about it. How many of you would look at me and go, well, that's way out of line, right? None. This can be upsetting, and it's okay. And I think that's part of the disease process, and we need to recognize that. that these are part of the disease process a lot of times. All right, let's do a practice, and then I want to leave some time for questions as well, because we got about 5 minutes left. So this is the grounding practice, okay? And so when I start working with this for people, what anxiety is a lot of times is it's predicting what's coming, right? And a lot of times we're not even in this room. So this is a way to quick get into the room. So everybody, if you kind of like look around the room right now and just kind of notice yourself, what are 5 things you see in this room around you? Maybe even acknowledge, like looking around after you get your 5 things you see, what are 4 things you can touch? What are 3 things you can hear? 2 things you can smell, which is really interesting when we're wearing masks. And 1 thing you taste. And then noticing in this room, is there anything going on that we need to fight with right this second, or am I okay in this moment? And a lot of times that can bust us out of what's happening. Anxiety is predicting the future, which causes a reaction right now a lot of times. And this is one of my favorite quotes from a guy called John Kabat-Zinn. He does a lot of work in the mindfulness. He actually developed mindfulness-based stress reduction out at University of Massachusetts Hospital, working with patients who had chronic pain. Funny about it, he also said that he wished he could have called it mindfulness-based stress acceptance, but the insurance companies wouldn't pay for it then. So we can't stop the waves, and anxiety and depression are a lot of times like that. You can't stop the waves. The more we fight with it, the deeper we get into it. But we can learn to surf. We can learn some life raft tools. We can learn some things to get on top of it and ride it in. In doing so, increases health. It tends to turn down what's going in the body, including pain sensations, including inflammation. It helps with that. In my job, the way I look at it when I start working with patients is to give your gut the best chance possible, working with my medical colleagues, working with our dietitians, and the patient and I working together, giving the gut the best chance possible at functioning the best way it can. Oops. And I'll go back and we'll just go. What are your questions for me? Yeah. Yes. Uh-huh. Mm-hmm. Sure. Sure. Mm-hmm. Yeah, and I would say this, that, with psychiatric medication, it's so hard that we don't have specific doses for every person. And so the way it should be used and the way my psychiatrist colleagues would use it is we titrate up to effect. So in someone who does have malabsorption issues, especially if we get into patients who have like short bowel post-surgery and stuff like that, it may not work, and we may have to do some of these things. Medication is a tool. It's not necessarily a cure for all these things that are going on. And sometimes it can be very, very helpful. The way it should be done, though, always is if we give it to someone, let's monitor now what's going on, and we'll adjust dose as needed. And we may have to go higher in patients who are not absorbing the rest of the way. Does that answer your question? Okay. Any other questions? And I did want to say, like I said about fatigue, one of the issues with some of these symptoms that do show up that are part of the experience with ulcerative colitis and Crohn's disease, especially like fatigue, is they're so multifactorial, right? And it's so hard to pinpoint exactly what's going on. And that's why it's us working as a team, that my medical colleagues, checking lab values, making sure your B12's okay, making sure iron levels are okay. It's also then looking at diet, and so having our dietitians work with people on what we can get in to fuel our body the best possible. But then it's also doing all of these things. And a lot of times what I'll tell people is they'll go, I don't know which one it was. And I'll look at them and go, it was probably all of them, that everything may be contributing this much. And maybe it was all of it together that helped you. And I think that's the way we're starting to look at care too, is that all of this together, everything we do together, gives our gut the best chance possible at working. My medical colleagues altering the biochemistry of the body with the medications and helping the gut symptoms and slowing it down, speeding it up. We have great tools there, and their knowledge is fantastic. Our dietitians, there's no way you can put pounds and pounds of food through a little tube and it not affect the tube. And we're finding out more and more it affects the tube more than we ever realized. Working with our colleagues over in rheumatology and stuff, hormones hit the body. It is all of this together in modifying all of it and working with the person, the patient being the most important member of the team, because all of us can see this stuff. You know your body better than anybody in this world, and we have to work together to try to build that care. Anything else? All right, thank you.